Absolutely. So my name is Jim Squires. I'm a pediatric hepatologist or a liver doctor. I practice at the University of Pittsburgh Children's Hospital in Pittsburgh, Pennsylvania. I have a fairly long-standing clinical interest in PFIC. Pittsburgh is in close proximity to the Amish Mennonite population, mainly based out of Lancaster, Pennsylvania, where the original biler disease was initially described. And so the biler disease is PFIC type 1 specifically. And so because of our proximity to that community, kind of got a long-standing clinical history of caring for patients with Byler's disease. Obviously, that interest has spread to other cholestatic diseases, including the PFIC2 or BSEP deficiency, as well as the Alagille kids. So it's been exciting to see some of the recent changes that relates to the way that we can clinically manage and treat these kids. And so I'm excited to be here today to talk about that. The kind of umbrella term that we would use to describe these conditions are kind of cholestatic liver disease. And so when we talk about cholestasis, really what we mean is a lack of bile flow. And bile is a product, a liquid kind of produced by the liver that needs to exit the liver in order to help us absorb fats and do kind of some other functions. And when you can't drain bile from the liver very well, that's cholestasis, and that leads to a buildup of various substances, including bile acids, which we think sometimes can lead to toxicity and injury. I think the mechanisms behind Alagilles and PFIC are a little bit different. They are both genetically based disorders, but PFIC is more related. PFIC is, again, a family of conditions that stands for progressive familial intrahepatic cholestasis. And this is a family of conditions whose major manifestations include cholestasis, and the inability to kind of get bile and bile acids out of the liver efficiently because of various mutations in proteins whose job it is to transport bile acids and get them out of the liver. Whereas in Alagille syndrome, again, is another cholestatic condition. So you have challenges getting bile out of the liver, but the mutation there is more related to the development of the biliary system, or the kind of the ducts that are responsible for draining bile from the liver. So in a sense, they can look similar in an individual patient, but the mechanisms behind them are a little bit different. The PFIC studies were, again, studies done in patients with PFIC, which is one of those disorders that we recently just mentioned. And what they looked to do was assess the ability of a new medicine that has been recently trialed in these patients, something called Bylvay. And Bylvay is what we call a family of medications called IBAT inhibitors. And IBAT stands for ileal bile acid transporter. And in short, what these medicines do is they block the intestine's ability to reabsorb bile acids, which, as we kind of previously noted, we think kind of partly contributes to some of the ongoing liver disease in patients with these disorders. The other thing that bile acids do that we know a buildup of bile acids can cause is really intense itching. And itching is one of the main manifestations of these disorders. So patients with these disorders can really have a terrible sense of itch. And so what the PFIC study essentially looked to do was to assess the kind of long-term impact of these medicines on patients with PFIC disorders. And excitingly, what it found is that when patients kind of stayed on these medicines long-term, we noted that you were able to kind of decrease the bile acid levels in the blood, which is good. So it shows that these medicines are effective over the long term. And it was also, that finding was paired with a decrease in the amount of itch patients sustained when given kind of an itch assessment score that they kind of filled out at various time points. And so, we had some earlier data to suggest that these medicines were effective in shorter time periods, but this was one of the first studies that really, over a much longer period, was able to assess that benefit was sustainable. Now, again, everything in our body, is that way for a reason. And, bile acids are important for certain kind of, physiological mechanisms, one of which is to help us absorb fats and grow and absorb kind of fat-soluble vitamins. One of the questions we had was if we were kind of blocking the way that bile acids typically are handled by the body, would we see an impact on things like height and weight and some of these other issues related to growth in children. And I think what the long-term study showed is that, if anything, these things actually increased. And so there was improvements in height, there was improvements in weight. And again, that was paired with lowering of itch and lowering of the serum bile acids. And so all in all, I think what was really exciting about this study was that it showed, A, that these medicines were, kind of the early studies that we showed that had, really such incredible promise, that these findings were able to be sustained over a long time, and that kind of improvement in the kind of clinical features was paired with improvements in growth, improvements in weight, and improvements in some of the other things that like itch, that we know that can be a significant symptom in children with these disorders. I think what we can say with quite a bit of confidence is that these medicines, these IBAT inhibitors, are safe, that they appear to be effective over a much longer period of time than was previously known, and that in addition to improving one of the most important symptoms of these disorders, which is itch, we also are starting to see suggestions that they actually may also improve the patient's kind of clinical status over time when we look at more objective measures like height and weight and nutritional status. Sure. So again, the ASSERT trial was a similar type of study with these medicines, these IBAT inhibitors, particularly Bylvay. But instead of looking at the PFIC population, ASSERT was looking at the Alagille population. So again, a different genetic-based disease, but with similar symptoms of itch and cholestasis. And again, I think what the ASSERT trial was able to show was that over an extended period of time, patients who received the Bylvay or the IBAT inhibitor did have clinically meaningful reduction in their itch, which again is, I think, one of the most important symptoms that these patients have, or at least the most impactful. That was combined with a lowering of the bile acids, which is what we would expect on patients who are taking these Bylvay medications. Also similar to the PFIC trial, what we saw is that the height and weight also increased in patients who were on these medications. I think what's important in the ASSERT study was that this also assessed patients who had previously been on a study where they had been receiving placebo, right? So typically when you do early studies, you have a placebo arm where they're not getting the medication, and then you have a treatment arm. And that helps in some of the early studies to assess, how effective a medication may be. And in this ASSERT extension trial, all patients that had been receiving the placebo were then kind of rolled over to the active medication. And it was shown that those who kind of rolled over to the active medication began to see the benefits of those that had been on the medication. So again, I think a very exciting study to suggest that Bylvay, really may be impactful and an important medicine in the kind of armamentarium of the treatment of both of these conditions, Alagilles and PFIC. Yeah, I think really what this data kind of collectively shows is that Bylvay appears to be safe in patients both with Alagilles and with PFIC, and it also appears long-term to be effective in lowering serum bile acids and improving itch in patients with this condition, and that we did not see significant side effect profile that would raise red flags as to the long-term use of these medications. These were really exciting kind of abstract type presentations, and so obviously with any of these, we look forward to kind of the full complete manuscripts that will hopefully be out soon. And again, I think it's just been a wonderful thing to be able to offer our patients these new medicines.